judges and audience, we are Claire, who use AI to improve chronic disease management. Our team consists of young talents with clinical, data science, business, and design backgrounds who hope to utilize our knowledge in making a difference in our healthcare system. Chronic respiratory disease affects patient airways and the structures in the lungs. Common ones in Hong Kong include chronic obstructive pulmonary disease, asthma, and sleep apnea. Inaccessible healthcare on chronic respiratory disease has been a huge problem in both Kenya and Hong Kong. Even worse, the outbreak of COVID-19 has exacerbated the situation. So how COVID-19 has disrupted routine healthcare services? It is by shifting the collective resources away from chronic disease management to the prevention and acute care for COVID patients with severe presentations. Patients with non-COVID pathologies could hardly access to community-based care and cause referrals to hospitals. Lockdown during the pandemic also plummeted patient participation in physical activity. Patients may have postponed or even canceled medical appointments due to fear of possible COVID-19 infection suggested by reports. These factors have accelerated the progression of the disease. Unlike the ventilator proposed by the Kenya team, we developed an AI-driven chronic respiratory disease management system consisting of a prognostic system for healthcare providers and a self-management mobile application for patients. Our AI prognostic system allows doctors to reliably assess the progressive risk of the patient. By providing detailed risk factor analysis, high-risk patients will be referred to hospital for early treatment, while low-risk patients will receive preventive interventions within the community. In this sense, we can raise public health awareness, enhance disease prevention, and reduce the unwarranted use of hospital services. And since patients lack educational resources, we provide a free-of-charge self-management mobile application in which users can continuously monitor the disease with an in-app risk assessment. Self-management skills with our evidence-based educational and motivational components are provided to alleviate their symptoms. And here's a prototype of our mobile application. Our AI system will generate a risk factor report based on an in-app simple survey, which requires users to answer whether they have specific habits that might induce progression or regression of the disease. So other than survey, the prototype of our AI prognostic system analyzes additional parameters and medical images like X-ray for healthcare providers to conduct a more holistic assessment, assisting doctors to construct a more personalized treatment plan and conduct accurate referral. To ensure our solution could be implemented in our society, we collaborated with various NGOs to provide health talks and workshops. Not only do we hope to provide education on our own mobile application and raise awareness on their health conditions, but also to collect user feedback on our mobile application and to understand their needs not through books or TV shows, but real-life interactions. This is because we highly value their feedback because we want to modify our app to become user-friendly so that elderly could use it with ease whenever and wherever they want. Sorry. Our AI solution is also expandable to other chronic disease. So far, we have developed Asia's first AI-powered knee osteoarthritis management system and launched its respective self-management mobile application. Trained with more than 20,000 US and Hong Kong samples, our system are able to predict with a state-of-the-art precision of over 80%. Our innovativeness and business viability were also recognized by numerous innovation and entrepreneurship awards. Our story of success and passion to improve chronic disease management have also attracted different media coverage, with our determination in being a contributing part to our healthcare system. Our team believes that our system could create a paradigm shift in how chronic disease are managed under our healthcare system. So, please join us to make a difference in this aging society. Thank you.
Hey, thank you very much, Dean Polly, you from Claire. It's a great presentation, very extensive. So I will pass on the first question or any additional questions to Ms. McCain. Um, Please go ahead.
Thank you. I share the honor of sharing a name with this exciting innovation. And I really enjoyed this presentation. I thought there was a really good analysis of the gap, especially after the effects of COVID-19. And it seems like a really innovative idea. My question relates to the financial sustainability of this model. So it sounds like it's a technologically advanced system that probably requires a lot of maintenance, and because you're dealing with personal information of patients, I'm sure you have to give a lot of consideration to security. But I know that you're also trying to make the system, the prognostic system, free of charge. How do you ensure financial sustainability of this innovation?
For the sustainability part, we do have the financial and the sustainability plan, which we can move to Appendix 3. We have a sustainable business plan. Okay, so here we have two parts. The first part is from the community sector, because we do have different collaborating NGOs. While they will pay us free when we do the health education workshop with them. So this kind of charges also be one of our income source to maintain our business and maintain our technology and also app. And also we do have different funding support partners, and at the above column we can see here is the funding we have already get it, and we input it into our develop our technology and also algorithm. So these are one of the our major source of income to sustain our business and development of our application. And another revenue we can generate is from the healthcare setting. And we are going to collaborate with the local public hospitals to conduct the clinical trial. And after the clinical trial being passed, and then our service can be implemented to different healthcare providers. This can also generate a revenue for us and to further develop our solutions to other scope and benefit the society. Hope it can answer your question. Thank you.
Yes, thank you so much. Am I correct in seeing that the project started in 2021?
Oh, that's our project in other chronic disease management, because our team also tackle other chronic disease management. And now because of these USRN opportunities, we can further expand to other scope and inspired from other team. So we are going to expand our scope after this competition, and the revenue model are just similar to sustain our business. Yeah.
Thank you so much for that clarification.
Thank you very much, Ms. McCain. Any questions from the facilitator side that you guys would like to ask?
I have a clarification question. Thank you so much for a wonderful presentation. It was very clear and well organized. I am curious that, I might have missed it, but I'm curious that the users are the healthcare practitioners, right? Because in the presentation, I heard that that this app will help them organize the data better and prepare reports better. This AI-based software or application can help the doctors or healthcare providers. So is my understanding correct that the users are healthcare providers?
I think I'll answer that. As mentioned with our business model, our project has two parts. So one is on the community side and one would be on the healthcare provider side. So the one you just mentioned would be the one on the healthcare provider side, so hospitals and secondary healthcare. And our system also has a part that targets the community side, so the average users, the elderlies, and in community healthcare settings. And that would be the self-management mobile application. I hope this answered your question. Thank you.
Okay, and one follow-up question would be, are you going to charge healthcare providers to use this app?
Yeah, we'll no, the application is for free, but then the more advanced prognostic system would be charged if it was being used in a hospital.
Okay, all right. Thank you so much.
Thank you.
I think one of the major one it would be I think the group from the PolyU, because I think they have been working for the ideas for very long, and they receive a lot of funding and support from other parts too. So maybe at your part you have to consider if they really have, because we have the score sheet. So one of the items, let me check, is about the localization and adaptation. So maybe you will have to consider about this point. This only point you have to consider. That it seems that they haven't adapted anything. So maybe there's only one thing to consider. But we will send out an email for all the judges. Yeah.
I think in that.
I did get a little.
Sorry.
Go ahead.
Go ahead. No, go ahead. Go ahead.
Yeah, I also did get a little bit confused around that one and what the purpose of this would be if it was something that was already being implemented.
Yeah.
I think
And
on
also,
that thought, just my sort of point of view as well, to be non-biased about this, because I know initially, just for the context for our discussion as well as recorded, so all judges can see this as well. Initially, this team particularly submitted an AI fully adopted solution that you can see from their from the deck as well, funded, operational. They already have some trials with clientele partnerships. But that given in that sense is because they're so technologically oriented, especially using AI. And basically any type of data sets that they can obtain, as long as they can put it into the system can learn it because it's AI. So it means that in terms of the challenge itself, they did state that initially from Kenya is a repository problem, and Kenya decided to introduce an actual physical product, a ventilator that is more cost effective to alleviate some of the healthcare concerns from a cost or operational resource perspective. But putting into the Hong Kong context, they did not use it as a physical product, as a ventilator, but they approach it by addressing the respiratory chronic disease as a data, of course, leveraging their existing solution platform, which is easily more scalable. So I think there might be, of course, some mixed information which kind of affected how they position themselves in adopting the solution, which of course I think that could be from an evaluation standpoint could be assessed. But based on a non-biased standpoint, there is still, I guess, a glimpse of how they understood the context by adopting locally, because Hong Kong is much more developed, first-class city, very busy, very tech-savvy as well. So I think just kind of giving that point of view to be fair on the judge criteria, for of course all the judges to look at this issue. Yeah. But of course they definitely came in way too far off from an adoption standpoint and from an experimental standpoint. Yeah.
It's a brilliant innovation. It really is.
Yeah, I think that's the thing about technology itself. It's so disruptive that as long as someone has the infrastructure already built, it's so easily scalable to any problem or challenges as long as it can feed into the actual system itself. But that's also something also overlooked sometimes is, do we actually need to innovate a technology all the time when there's a sufficient, very large scale infrastructure in place that you just put everything in as an aggregator, that we don't have to develop like so many apps, so many systems, right? And is there an extensive, inclusive enough medical treatment system across the citywide, fully tapped into clinical data, medical records? Of course, it's very ambitious, but I think if that's the path they're building on top, like the team mentioned, they are only extending that as a sector or basically as a sector or as a data that they're really seizing as a market opportunity. So yeah, that's just my thought process on that point.
But also on that point, because they have been working on this project like a system for years.
Yeah.
So I think when other groups comparing to them with like really primitive, really not well thought out. So it's also wanted to be fair for other groups too. So, but I think I'll put that up to the judges to decide. Yeah, and then I think you could design individually. You don't even have the consensus. You just take the sheets. I don't have a constant. Yeah. Whatever you think is suitable to judge that. Yeah.
So Albert, as a reminder in this recording, how many winning teams are there just for the judges revision? There's more than one, right?
Yeah, I think we have two. We will eventually have two or three. Two, must be two. Yeah.
Okay. All right.
But it won't matter for the judges because the judges would just put out the score.
Mhm.
We just calculate the overall score and then compare the highest 2 or 3. We get the SIP funding money. Yeah.
Okay. All right. Any other questions or concerns, Ms. McCain, that we can address before we go back to the main room and wrap this up?
I think everything is clear, especially if the other judges have access to the previous recording where all the judges discussed in the morning session.
Yes.
All right. Okay, great. Thank you very much.